Hey guys, Dr. McCoy here at Drummond Chiropractic. Today I'm going to go over some exercises that we commonly recommend for knee pain. If you have any knee pain, it's very depending on where you're having the pain or where we find compensations or what structures we want to target the most. But the ones that we top recommend, I'll go over here today. So the top one is usually releasing some of the tension trigger points in your adductors, so the muscles on the inside of your leg or groin area. When that is a commonly kind of not stretched, not used area, forgotten about, and it just kind of builds up over time, it can start to cause a lot of pain on the inside of the knee as well as on the patella as well. So using your foam roller to help roll that out is a good little mobility tool. So you kind of lay down on the ground, get in the frog leg position where your arms out to the side, and then rolling it out, even flexing and extending the leg while holding a little pressure there can help relieve that tension in the adductors, that inside of the leg there. The next is doing kind of single leg holds for balance and really challenging the stability. So you can take off your shoes to make it a little bit harder, but just simply holding one foot out, going side to side. You should be able to get to a minute. And then the big thing is when you're doing that, making sure your knee's not caving in or going out. You want to keep your knee exactly in line with your toe. And then if you want to add a next step to that, that's doing kind of hops back and forth. And then the same thing is when you land, making sure your kneecap is always in line with your toe. You're not landing in that cave position or the out position to really challenge the stability of the knee. If your knee is caving, I see that a lot when people squat. A good strengthening exercise is to get a band like this. You wrap it around the outside of your knees, and then when you're doing squats, you can push out into the band because it's giving resistance because it's wanting to push your knees in. So then you can brace out into it, and it kind of helps make that motor memory pattern, and then it'll easier for you to remember to push out your knees when you're going through that squat so you don't have that knee cave going in. That strengthens the outside of the hip and as well as the stability around the knee. The last one is a little bit more complex. This is again challenging more of the stability of the knee, but it's single leg deadlifts. So what you want to do with this one is a kettlebell or a weight, and then you're going on one leg, same thing, making sure your knee's not caving in or out, tracking with the toes, and then you go down, try to get the weight as close as you can, coming back up, as well as keeping the back flat. That is a little bit more of a complex movement, but that's what we can progress you to once the pain goes away, and then we're focusing less on pain relief and mobility and more on stability around the joint to make sure everything can function, and you're using multiple joints, multiple areas. So it challenges your core, challenges your back, challenges your glutes, all of the above. So then you can transition that into performance, into daily maintenance so that the knee pain doesn't come back, whatever your goal may be. So if you're having any knee pain or have any more questions about those exercises, just give us a call here at Drummond Chiropractic.